Fast forward 25 years. I first met Beverly 25 years ago in this room, and we had the most wonderful conversation about how pleased she was with her dental implants then. And what we're going to do is talk to Beverly again and find out how her experience has been over all of these years, and also about her experience with Dr. Barbanel and his practice here. So Beverly, thank you again for coming. Welcome. It's a pleasure to see you after 25 years. You haven't aged a bit.
Yes, yeah. Thank you.
I've lost a little bit of hair. Tell me about your first implant and your experience with Dr. Barbanel.
Well, I'd been coming to Dr. Barbanel already for several years, and I was going to lose a tooth, or I had lost a tooth, I don't remember. That was 25 years ago. So he put a single implant, which would then anchor a bridge on the lower left.
And he says that you were his first cylindrical implant patient at the time.
Yes. I don't think I knew that I was his first patient at the time. I knew it later. He might have told me, but I don't think so.
Okay. And obviously you had a lot of confidence in him back then.
Correct, because I don't think I had even, at the time he approached me on it, I'm not sure that I had even heard of an implant. And I think before we started the procedure, I saw an article in a magazine or something and read up on it.
And you have been coming to Dr. Barbanel since.
Correct.
And you've had additional work done since to your apparent satisfaction. Tell us about what work you've had done.
Well, I've had probably 3 or 4 more implants, and had the bridges anchored to them, and now a lot of times he'll just do a single implant with a cap and not attach it to a bridge.
And how do those function for you? I have to tell you, you speak with a lot of confidence, you look terrific. Tell us about how they function.
They function just like a regular tooth. I mean, I could eat an apple or a piece of caramel or whatever. I mean, there is no difference.
Not that you should eat a piece of caramel.
No.
No, but you could if you want.
I could if I wanted.
And if someone were to ask you about your experience with Dr. Barbanel and his practice and his staff, what would you tell them?
Well, I have referred people here to him, and that have become his regular patients. I come here to get my teeth cleaned. I see the dentist here. I see him. I really haven't gone to another dentist in over 30 years.
Okay.
And I don't even live in the area anymore, so it's like a 45-minute drive for me to drive into his office.
That's commitment. Yeah. So you've been a patient of Dr. Barbanel and his practice for well over 30 years now.
Correct. Well over 30 years.
I've been a friend of Dr. Barbanel's practice for over 25 years, and I'm amazed at how many of his original people are still here, not just patients, but his staff. Tell me about your experience in working with his practice and his staff over that 30-year plus time frame.
I'm kind of on a first-name basis with most of them. Sometimes I'll call in the office on the insurance, Diane, and she recognizes my voice. And the hygienist that I see, I think I've been seeing her for 15 years.
Wow.
Maybe 18. So
there's a lot of consistency here.
Correct.
Yeah.
A lot of consistency.
And obviously with the additional implants you've had over the years, you've placed a lot of confidence in Dr. Barbanel. Tell me about how he makes you feel as a professional.
I always feel very comfortable with him. I feel like that he's going to give me the best advice, and I can take his advice and feel confident that I don't need to double check it or go to another dentist for a second opinion.
Good. You know, Beverly, Dr. Barbanel talks about how important his patients are to him personally and of course to his practice, but he really prides himself on creating good, lasting, interpersonal relationships with his patients. And he's told me that he feels that way about you. Tell me how you feel about him in that way.
Well, like I stated, I do totally trust him. And if I come to see him with a problem or a checkup or whatever, and he gives me advice on something that I might need to do, then I take his opinion, and I don't go to another dentist to get a second opinion. And I wouldn't necessarily say I would do that with everyone.
Okay, so there's a lot of confidence there, a lot of trust.
A lot of confidence, a lot of trust, and I believe him. I don't think he's just trying to make another dollar off of me.
Let's talk about the cost for a minute, based on what you just said. It's obvious that you can spend tens and tens of thousands of dollars for dental implants if you go to a Beverly Hills cosmetic dentist. And on the other hand, Dr. Barbanel has a mission of making his dental implants affordable and functional and still cosmetically pleasing. What's your opinion of the cost that you've invested in your dental implants?
I mean, I'm very happy with it, and as far as I know he's of a reasonable cost, but do I know what it would cost at another dentist? No, I don't know that. I've seen things in the paper, I've read articles, but I've never gone to another dentist to get an opinion of the cost.
It's best. Do not go to Beverly Hills and ask what you would have spent over these years, because it probably would be a lot more than you spent.
That's too far to drive anyway.
That's probably true. Beverly, you mentioned that you no longer live in the Long Beach area and that you drive a good distance to see Dr. Barbanel and his staff. Where do you come from and why do you make the drive?
I now live in Yorba Linda, the very northern part, and I haven't worked in Long Beach for the past 12 years. So for 12 years, I've made the trip to come to see Dr. Barbanel from Yorba Linda, which on the freeway, I'm either early or late. Usually early because I don't like to keep them waiting. I came in because I wanted to help him put our point across to other people that might be considering him as a dentist or considering having implants, to know that I did this just from a friendship, from a statement of wanting to help him. There's no monetary issue for me. And once it's over, I get to get on the 405 and head back.
I feel your pain.
Yes.